Can I hear you? Good morning, good afternoon. It depends on where we are. Well, welcome, and thank you so much, Miguel, for that wonderful warm-up. And first of all, I want to say a huge congratulations to all the doctors. Today is their day. We would like to extend a very warm welcome to this webinar organized by Thank You Doctor in collaboration with Diario Salud, and special thanks go to our parent foundation, Dr. Ramon Tallaj. Well, today is a very important day because it is World Family Doctor Day. As part of the Thank You Doctor campaign, we want to take part in this international celebration by recognizing the truly remarkable and tireless efforts of family doctors and primary care physicians across every corner of the globe. This year, WONCA, which is the dedicated organization that first introduced the idea of having International Family Doctor Day, provides a wonderful opportunity for us to reflect, and we've certainly taken up that challenge, on something that is incredibly significant and relevant these days: compassionate care in an increasingly digital world. We are currently living through a deeply profound and rapid transformation in the field of medicine. Artificial intelligence, telemedicine, electronic health records, and innovative new diagnostic technologies and tools. But at the same time, I think we all have a big question. How do we maintain closeness, empathy, and attentive listening in our new digital era? Today, we are joined by two truly exceptional individuals who are here to help every one of us reflect deeply on this significant challenge that you doctors face daily and that we all share together. Because, after all, this is something that affects us all. Sooner or later, medicine touches us all very personally. To begin this, I want to say that it is a truly remarkable and distinct privilege, an absolute privilege, to have the esteemed Dr. Ramon Tallaj here joining us today for this special occasion. We could say a lot about him, but let's keep it brief, because we couldn't possibly fit all the highlights of our founder's career into one summary. The promoter of this campaign is a medical doctor, an internist, and a highly respected leader in the field of community health, who is recognized on an international level for his dedicated work in providing healthcare access to the most vulnerable populations. He is the visionary founder and current president of SOMOS Community Care in New York City, which, for those who might not know, is one of the most important primary care networks dedicated specifically to the health and well-being of the most vulnerable people in our society. Throughout his extensive and distinguished professional career, he has consistently promoted a unique healthcare model focused on something that seems basic but is often forgotten: the fundamental concept of patient-centered care, with a special emphasis on the humanization of medicine, personalized attention, health equity, and the seamless integration of community services. His groundbreaking work has been widely recognized and celebrated by institutions all around the world. Many countries have acknowledged the work of Dr. Ramon Tallaj, a commitment to medicine that is closer, more accessible, and more compassionate. He is also the visionary founder of the Ramon Tallaj Foundation and the original founder of our nationwide Thank You Doctor campaign. So with all of that being said, I'm going to leave you with the incredible doctor who is the one who made it possible for all of us to be here together today.
Good morning. First of all, thank you very much for the invitation and for organizing this important webinar on World Family Doctor Day. I'm going to make some references that I have noted here, and I'll make some comments, since Matilda has allowed me to, but I also want to read a few points because I want you to understand how important what we're doing today is to me. And I hope it continues into the future. When we talk about technology and healthcare, we usually think of artificial intelligence, telemedicine, or digitalization. But today, I'd like to talk about something even more important: preserving the humanity of the physician amid all these changes. The family doctor doesn't just diagnose illnesses, they also accompany people. They accompany the family and the entire community throughout their lives. They have that knowledge. in that neighborhood where they're established, in that area, in that rural setting, in that simple practice where they see people every day, often for generations. I have doctor friends who have seen children grow up to become grandparents and are still working. So it's something where that empathy is very hard to change. They know the patient's social, emotional, and human context. Many times, a conversation, a look, or the trust built over many years has as much impact as a medical treatment. That's why medicine remains one of the most human specialties, closest to the patient. Let me explain. Digitalization, without a doubt, has brought not only more advances, but also some risks. I mean, medical professionals often spend more time looking at computer screens than looking at patients, constantly hunting for results instead of understanding the patient. This is a harsh reality, but once the patient is finally diagnosed, what's the most important part of the follow-up process? Why are they going to do it? Who are they going to trust? Why are they coming to see you? Do we want to have computers in every aspect? Are we going to have AI instead of lawyers and trials now? Computers that listen to what's being said, the questions they're going to ask to determine if someone is guilty or not. Are we going to replace judges? They're not needed. The law's written. Digital bureaucracy, electronic medical records, and the pressure of patient care can make us lose time and keep us from listening and connecting with the human side of that patient. There's a danger of turning ourselves into a technical process and not an encounter between two human beings with the trust that one brings to care for the other. Artificial intelligence and new technology should be tools to help the doctor, not to replace the human relationship. There will be countries where a dictatorial government system could do this because of the pressure of overpopulation or because the people are poor, one way or another. They're not given attention or they're looked down on. I don't think that should happen. We have to fight to prevent that. If technology reduces repetitive tasks to improve diagnosis or make access easier, then with that help, AI that takes care of all that, we can spend more time listening to the patient, being there for them, so they feel like they're part of us and we're part of their problem. The question isn't whether technology is good or bad. The real question, folks, is how do we use technology to become more human? No algorithm can completely replace empathy, compassion, or trust. On that, folks, we all agree. A patient doesn't just need medical answers, their tests, the results. What I did for you, no, they need, as I just said, to be understood. You really need to be a part of this conversation. Where are we headed if depression is treated by a machine? How do we ensure that the patient does not commit suicide? How do we ensure that every single patient feels completely satisfied and truly helped? Especially in primary care, where doctors often accompany patients through long processes and chronic illnesses, the human side is extremely important. Now, we can't talk about humanization without also talking about the doctor. Doctors suffer too. Doctors are involved too. Doctors are human beings as well. A doctor who is exhausted, overwhelmed, or emotionally burned out can hardly provide fully human care. That's why humanizing medicine also means taking care of those who are listening to me, not just the patient, but also the doctor. We need to pay attention and find ways to prevent what is now called burnout. The future of medicine will undoubtedly be digital, but I hope it will also remain deeply human. Technology will change many things. But it should never make us forget that behind every screen, every piece of data, every diagnosis, there's a person who needs closeness, trust, and compassion. And that's where, folks, the family doctor remains essential. We might be able to create technology with a human shape and form that can run faster than a runner in a track and field race, like a car, like a plane, just in human form. We will never be able to make a machine sit in front of a patient and have the patient feel truly listened to and understood. Technology can help us heal better, but only our humanity will allow us to truly keep caring. Thank you.
Thank you so much, Dr. Ramon Tallaj. It is truly a great honor to be part of your team, ever since the Thank You Doctor campaign began. We are grateful to you. Our General Coordinator, Elena, and I from the Communications Department would like to express our sincere gratitude for this opportunity to communicate the message you have always upheld, which is the humanization of the family doctor, and we truly hope to live up to your very high expectations.
Just imagine that.
We reach.
A world where we all completely become mechanical and robotic.
That's where we're headed, Doctor. With your campaign, I want to share, before introducing Dr. Jaqueline Delmont, that what started as the doctor's dream has now reached almost more than 1,200,000 people who have signed this declaration. What we thought it was going to be? Well, it started as just a simple declaration signed by 1,000, maybe 2,000 people, but we've now reached a total of 1,200,000 people, with more than 35 different institutions and foundations joining our campaign, and we're continuing to move forward every day, still working hard. We're going to have some new and exciting updates very soon, and it is truly a great honor for all of us to be inspired by you, Doctor. Thank you so much. Now, we are truly honored to have another exceptional doctor who, among many other things, is a dedicated part of the SOMOS team. She is Dr. Jaqueline Delmont, a highly respected Venezuelan physician and a seasoned healthcare executive who has spent more than 20 long years building vital bridges between clinical excellence and professional rigor. Within the competitive landscape of the modern business world, as both a medical doctor and an MBA, she stands as the visionary creator of strategic empathy, a powerful concept that effectively transforms and reshapes medical vocation into sustainable, value-based healthcare systems. From the initial founding and establishment of Delmont Medical Care, to spearheading and overseeing major public health initiatives in places like Yankee Stadium, Dr. Delmont's long career has been consistently characterized and defined by her deep commitment to the most vulnerable and underserved communities throughout New York. We clearly see that our dedicated doctors, deeply inspired by the work of Dr. Cala in Nuevas Generaciones, have already successfully served as chief medical officers. They have held the position of chief officer for several major healthcare networks and are currently managing large-scale nearshore BPOs. She has demonstrated that even the most complex operational challenges can be effectively addressed through highly flexible, agile, and compassionate innovation. Well, looking far beyond the executive sphere, Dr. Delmont has become a passionate advocate for the next generations of leaders. She is dedicated to empowering minority professionals, teaching them how to lead with genuine heart while maintaining a high level of executive precision in everything they do. She is a firm and passionate believer that inclusive leadership is the absolutely essential and fundamental driver of success in our complex modern society today. She is a dedicated member of the group of doctors at SOMOS Community Care. Good afternoon, good morning, Dr. Jaqueline Delmont.
Well, a very good afternoon to everyone. Thank you to Dr. Tablas and to his entire team, including Tamalata, for the incredible opportunity and privilege to participate in such a highly relevant topic. As always, the doctor consistently maintains a very close watch on what keeps doctors and their patients connected, which is the true north and guiding light for all of us who studied medicine out of pure passion. And I think this keeps us all on our toes, keeping everything at our fingertips so we can remain incredibly agile and responsive as we adapt to new things. That's why I want to take some time to really focus on an approach to the topic of the field of artificial intelligence and the human side, where humans have always shown a strong resistance to change. Wouldn't you agree? And in the history of medicine, and throughout the history of medical progress, there have been a significant number of very clear examples. Plenty of references to situations similar to what we're experiencing now with artificial intelligence. So, why is that? Because in medicine, by its very nature of protecting lives, it tends to be extremely conservative and skeptical of drastic changes. However, many of the tools that we now consider basic and indispensable for any medical consultation were, at the time, met with a lot of ridicule and skepticism, with outright rejection by the medical community of that era. And I want to give examples because our forums aren't just for doctors, there are also patients here. And maybe what for us are just med school stories might actually seem pretty interesting to patients. But I'm going to give three very brief examples. One of them is hand washing, which to me is one of the most dramatic examples. In the mid-19th century, a Hungarian doctor named Ignaz Semmelweis, thank you, he discovered that if doctors washed their hands with a chlorinated lime solution, they could reduce childbirth infections from 18% to 1%. Well, the resistance from the medical community at the time was incredible because how could a healing doctor with all his magic possibly be a vehicle for transmitting an infection that could affect a patient's life, even kill a patient? Never in their lives would they believe that. Our intention, which is something that's still real today, can actually end up harming a patient. However, owing to the fundamental reality that the field of modern science has always relied on rigorous validation through extensive peer-reviewed studies, this doctor's specific theory was eventually able to be thoroughly confirmed and validated. Unfortunately, he was so rejected and marginalized that he ended up in a psychiatric hospital, just like sometimes they want many of us who are at the forefront of things to end up there too. But anyway. Now, hand washing is the number one universal infection control measure in any healthcare facility. And in fact, we even monitor whether different people are washing their hands. Well, moving on, we have the example of the stethoscope. René Laennec, who invented the stethoscope in 1816, was a French doctor, and part of the reason he invented it was, wow, there were times when putting your ear directly, since that's how you listen to heartbeats, on a young woman or an older person. In fact, all doctors have different ways of making contact. Well, people felt uncomfortable, so he invented the stethoscope, a wooden tube, to create a bit of distance. And now everyone watching this talk knows that the stethoscope is a fundamental tool for medical diagnosis. Even abortion. There are articles in The Lancet, and when I studied this, it made me laugh, where one of our academic reference points said it would never be implemented. And well, now it's part of our everyday lives, and we even have electronic stethoscopes. And lastly, there's anesthesia. The story is that in 1840, before that, people would undergo surgery while being tied down, and pain was considered part of the process of enduring surgery. And obviously, after many decades, anesthesia has become, in fact, it's now considered a fundamental violation of a patient's rights not to monitor their pain. So, why am I bringing these things up? Because artificial intelligence, telemedicine, and digital interfaces make us feel that same discomfort, that same resistance all over again. To me, medicine history really shows us that the problem isn't the tool. The problem is that let's ensure that we are making the most effective and proper use of that tool so it can significantly optimize and streamline the specific way that we work, especially given all the paperwork, all the fear we often have in human interactions, and all the third party involvement from people with their own competing sets of interests. I remember when I used to go to the doctor, doctors would spend 45 minutes, an hour, even 2 hours with the patient, and they could make a living. They could buy their homes. They could educate their children by seeing 8 or 10 patients a day. It wasn't until the 1970s or 1980s when the payment method for doctors changed that a doctor had to see many more patients to make the same amount of money. That's when documentation and digitization really entered medicine. It was because insurance companies wanted to optimize the way they captured information. We, yes, we cared about documentation, but we were present in the act of practicing medicine. So, really, it's been the intervention of third parties that has brought about digitalization, documentation, and the whole legal struggle between patient and doctor and so on. So, well, just to bring this discussion to a close, I really wanted to mention a few other significant challenges. When it comes to the world of artificial intelligence, we simply can't deny that there's a significant and undeniable disparity, a very big difference between how we as users approach our complex financial matters, purchasing our daily groceries and household items, or even going to the local pharmacy, right? And when it comes to using technologies, practically nobody wants to go to a bank anymore. Now, money transfers are digital. However, the effort and resources that have been put into improving the overall user experience within the medical and healthcare industry have been disappointing and frankly terrible. The money invested in the development of these tools focused on optimizing how doctors work and how patients interact has been significantly held back by all these HIPAA laws. The doctor can make a referral, like when I send a patient to a medical specialist, right? So I know my patient's history, and yet I have to sign a form so that the specialist can release the report that I myself ordered just so I can better manage my patient. So, really, the optimization of the interaction among everyone involved in medical care is way below par. It's far behind how there's the interaction between financial entities, organizations, everyone involved, people who buy clothes, how food is purchased, and so on. So I think we need to invest a lot more resources so that users, doctors, medical assistants, patients, and their families can use platforms that are much more efficient. The other thing, just to wrap up, is to be aware that even though we all have a smartphone now, the access our patients have in underserved areas isn't necessarily the same access that, for example, and I always use myself as an example, I'm someone who's a super user, a highly informed user with fast internet, a good phone, and my background. However, many of my patients don't have internet at home. They don't have computers. Sometimes their phones are provided by the insurance company, which gives them a limited number of minutes that they can only use for very specific things. So the people who are setting these regulations are using their own point of reference as if it were the same as our patient's point of reference. So just to wrap this up, which I thought was a bit more provocative from a technical standpoint, I have to say I love it. That artificial intelligence, like many other technologies and groundbreaking medical advancements that are available, is currently under a significant global spotlight. But we simply have to adapt it so that it meaningfully enhances and improves those intimate spaces we can have with the patient, so that we can really look them in the eye, so that we can finally go back to being that compassionate primary care physician where we could sit face to face with the patient and connect visually, where we could see ourselves in our own experiences as doctors, as people, as family members of patients, as patients ourselves so that we can empathize with the patient instead of just clicking, right? To really make that connection by looking people in the eye. So, well, thank you very much again to the organization, to Dr. Tallaj, for giving me the opportunity to share some of the points of view that I believe are relevant at this time.
I really appreciate everything you've done, Doctor. Thank you so much to the both of you for your help. Outstanding, doctors! This is our first webinar, and we hope it's the first of many. We've started off with the best. I mean, looking at things from this point, I really don't know how we're going to possibly top an experience like this. So we'll start off with a question. It comes from a very dear and wonderful friend, the president of the Visible Foundation, Patricia Rapole, someone we truly care for and value very much, and who has been right here with us from the very beginning. I'm going to put this question out there for consideration. To both of you, how can we effectively prevent technology from becoming just one more significant barrier between the professional and the patient? And how do we make sure it actually serves to bring them much closer together?
Jackie Dama, you first.
Well, thank you so much. The doctor is always such a gentleman. Well, I think that's a good segue from what I was talking about earlier. I think what's important, I've seen this. I recently went to a conference on electronic systems, and obviously, with all the cynicism out there about people having access to information they shouldn't, and people making money by breaking the doctor-patient relationship. But there is technology that allows us to capture voice, document, and maybe we can educate doctors about it, to use that technology, to give them access first, because we assume that just because the technology exists, people have access to it. But there is some really interesting technology that will allow doctors, instead of typing, to actually look at the patient face to face, to have a conversation with them while examining them, and not have the stress of, after spending 45 minutes listening to the person talk about all the difficulties they're having at home, now having to sit down for 15 or 20 minutes to type everything up. And that my day ends up being 5 or 6 hours longer than the actual hours of direct patient-to-doctor contact. So I think that's the issue. Unfortunately, I think that, especially in medical technology, there hasn't been much connection with the user, and the people designing these tools have mostly designed them based on what they want to capture or how they want to monetize the tool, instead of how to make our lives easier. So I think my first suggestion would be that there should really be much more influence from us as users regarding what features the tool should have, so that we can look the patient in the eye instead of staring at the screen.
Doctor.
I'm going to take a slightly different angle because we have the ability to do that here, obviously. Today, I changed clothes with air conditioning. I showered with clean water. I drank water. I had breakfast. I had clothes to put on. That's not always the case. Jose Ramirez in Boca de Yuma, Dominican Republic, out in the countryside, doesn't even know his own medical history. He knows what's happening to him, but often no one else does. No one knows what's going on with him. Maria Rodriguez in the Bronx. Living down in the South Bronx area is someone who barely even has an insurance card. So from the standpoint of basic human reality, it's very easy for us to talk about this without realizing that there are still so many unmet needs out there that haven't been addressed. And yet we're already focusing on these technologies when in reality, the basic things still aren't available in our countries. They aren't available, and often, even when they could be, resources are misdirected, misused, and don't reach the people. Let me give you a typical example of something we see here. Look at how I'm digressing to get to a point. We have a little patient, and we have something called the social care network. These are things that affect patients' health, but they're actually social problems. A little girl in school, her parents work, and in the month of October, she went to the ER 6 times because of a sudden asthma flare up. The technology, they checked her, hooked her up to machines, took x-rays, and sent her to her doctor. But when we went to her house, we found it was full of mold. We thoroughly cleaned the entire house, sat down with the whole family to talk about proper hygiene, and thankfully the girl hasn't been back to the ER since. Where'd the technology help? Where was it that at this specific point in time, we as doctors and with the ways we have, along with various other professionals who visit homes, help that person so she wouldn't contract that same illness again, so she wouldn't have that problem again? So yes, technology definitely can improve things. I would even say, hopefully, technology will allow everyone, everywhere in the world, to have patient records, to know where people are, and to practice preventative medicine. I say that in my country, where I am in the United States, we have the best medicine for treating illness. It's based in hospitals. If you get sick in New York, you're going to get good treatment. The hospitals are excellent. But that's not health. You're already sick when you go there. It's about how to avoid that. In our communities, our job is to keep the patient healthy. If we could have a tool, Jackie, where everything the patient tells me is already being entered into a computer, I wouldn't have to give you, of course. I can ask him questions and that interaction comes up immediately. It's amazing. AI is amazing. And on top of that, I can use AI to spend time figuring out what different diagnoses there might be. It's wonderful. So now I can sit down with the patient and talk for longer, to tell them what needs to be done and why it's happening. Right now, in this day and age, doctors need to understand that many patients are going to know more about their problem when the doctor does, without a doubt. There is more access now for them to really understand what they're suffering from. So we can't ignore that there are other factors just as important, like crucial social factors, like the actual amount of time you spend, the time you can be with a patient, which will always have a significant impact and can never be replaced by technology.
Well, to be perfectly honest, Doctor, everything that you just said truly and deeply touches the heart, because I think you all became doctors because of your love for people, for humanity. No matter what kind of machines they are. Now, we have another wonderful question coming in from Carlos Molina, who is another great friend of ours from the Collaborative LabCorp campaign. He asks, in what specific ways can the integration of artificial intelligence further strengthen our modern health campaigns and provide better support for medical missions to significantly expand healthcare access, improve clinical quality, and deepen the overall impact within our local communities?
Yeah, absolutely. I think this is one of the areas where the benefits that technology can bring are significantly more apparent. Because let's say it's about focusing efforts on areas that potentially have the greatest needs. So, what they call big data, being able to manage data from the person working in the lab, with the data we have in the medical record, with the data the insurance company has, in places where information's available. In my case, since I'm Venezuelan, the doctor mentioned Santo Domingo, and I think Carlos is also from my country. That doesn't exist. The healthcare systems don't have that information. And so we really go back to the human component. We know through the people we know which areas have the greatest needs. So I would say that in places like the United States, where information is actually being collected, we can focus and know, look, I have Out of 1,000 patients, I have 100 who live in this zip code in this area. And maybe this is the ideal place for me to run a campaign. But I'm sure that when they run these campaigns, and in fact, we're well known for all these campaigns they do in Santo Domingo to provide medical, surgical, and other services. It's really because they've been doctors in that community, because they know people from the community, because they know there are ongoing needs in that area, and so they focus on that. So that's a very good question. Thank you. It once again highlights the disparity that exists between completely different communities, those with economic resources and those without.
Back in 1997, while I was living in the United States, during my very first medical practice, I clearly remember I had a little wooden box just like this one, and inside that box, I would carefully check the Rolodex, which was the specific place where all of the patient information was kept. To pull out, and it was all on paper, no electronic medical records. I had my patients, and there were a ton of folders. Artificial intelligence helped a lot, but there are still many countries, ours included, if you want, yes, I acknowledge it, where what happens to a patient is a mystery. When I was born in the Dominican Republic, not necessarily anyone else knew what happened to you except the doctor in that place. And that patient still has no way, despite all the millions being spent, for another place when they arrive at a hospital for a referral to have an electronic medical record or someone who visits homes. That's why these medical initiatives we do them every year. In the Dominican Republic recently, I think it was about 5,000 people that we attended to, where they do dyeing, laundry, they do everything. So there are a lot of needs. And AI, to a certain extent, is practically imperceptible. In some places, not in the more advanced areas, even here in this country, it's not the same in rural areas as it is in urban ones. There are a lot of differences, mainly because of the number of doctors available to provide care. Go ahead. It's still a challenge, and there's much more progress to be made. But even now, we have communities that are left behind in terms of what AI can do to help. From electronic medical records to roles like knowing what a patient has.
Very good question. Very good answer. Well, we have just 2 more questions remaining for us, so we have to start wrapping things up. And honestly, this celebration is truly filled with so many friends, because there's another question from another great friend of the campaign, Maria Mendez, who has an absolutely wonderful foundation of her own. Vacation is a human right. Of course, we're going to stand up for that. And her question is as follows. How exactly do we balance innovation and compassion so that our technological progress always continues to put people right at the very center of everything?
Well, the doctor's going to keep being a gentleman and let me speak. Well, I think I don't necessarily want to repeat what we've already discussed. It's a fact that there's disparity even in medical education. The doctor mentioned, I mentioned Venezuela, the doctor mentioned the Dominican Republic, and I'm sure that doctors in my country right now are not receiving the same level of education as a doctor at Johns Hopkins or at any of the most renowned universities in the United States. So, why do I bring this up? Because I think that in schools, the first thing that needs to be done is we really need to educate others and to talk a bit more deeply about these important topics in our medical schools. Instead of having that high level of anxiety about how I'm going to optimize my time using various digital tools, it should be more about truly understanding the deep value of human connection. It is about how an opinion, I think we've somehow lost that vital sense of how we as doctors can really transform things for the better. The power we have to change someone's life with a decision, with a piece of advice. People are now given a list, right? Which, as the doctor said, can generate a differential diagnosis. A person can even get it themselves by searching on ChatGPT. In the end, the decision's about the moment. Is this really the right thing for my family member? We see this, for example, in palliative care. The numbers might say that the patient can be given this chemotherapy, but since I'm pro palliative care, I always share my perspective with the patient based on my own experiences. So I think that these soft skills or knowledge, which have to do with empathy and humanization, should be taught a bit more formally in schools rather than just focusing on optimizing the use of technical resources. That would be my answer.
I'm going to speak differently. I'm going to talk about a different kind of innovation. She talks a lot about what she just mentioned. Let's talk about innovation in a system. Our healthcare systems have been based on diagnosing diseases and treating sick patients. Well, in what I do at SOMOS, we've created a different kind of innovation, an innovation focused on keeping patients healthy, on being proactive with patients, on trying to prevent patients from reaching complications. And if they already have a chronic condition, how can we prevent further issues? How can we help a patient avoid needing insulin or prevent them from developing complications like needing dialysis? Back in my country, people used to say that for diabetics, it was medicine, insulin, dialysis, lost feet, lost limbs. That's just not true anymore. This innovation we've achieved, a real ability to prevent, has allowed us to do this in a compassionate way. Because, as I was saying, for example, we have a typical case. We work very closely with Health First Insurance, for instance, which provides resources together with us for training, for all those things. And here's an example that stands out. In 2019, someone from the New York State Budget Office said that we had saved $360 million. Out of 25 groups, we had saved $360 million out of $420 million. And he said that we had reduced dialysis by 42% and admissions by 30%. And he says this and calls me and said, how wonderful, how many of the rare ones. But I told him those changes that this innovation of this project brings, you have, for you, it's money. But Maria Ramirez, whose husband is diabetic and did not lose his leg, does not have to take him to dialysis every 3 days. It's happiness. It's health. It is an efficient community. So that is right, Maria. Innovation must always go hand in hand with compassion and ensuring we stay certain. And that's what we try to tell our politicians, that resources have to be maintained to keep the places treating illness as number one, because there are many sick people. But we need to put more resources into prevention. More resources, the first thing that gets cut are quality points, but it shouldn't be quality, it should be the opposite. We have to keep pushing forward, find a way, whether it's us or whoever else it might be, to make sure the preventive side truly succeeds with that innovation in prevention, with all the things we already know, so we can be compassionate with our patients, so we don't have to see such complicated cases and a deeply suffering and sick community.
Hey, just a heads up. I think you might be on mute right now and we can't hear what you're saying.
Sorry. Well, I'm really sorry, because this day of celebration, which is so important to us for the campaign, is coming to an end, and being able to share it with all of you means a lot. Our final question for today comes from the Visible Foundation, which is also currently chaired by Patricia Repor, who is known as a truly dedicated fighter for patients' rights. She asks, are we really measuring the value of healthcare technology well, or are we still valuing innovation more? Miguel, can you put it up again for me? I lost the question. Or are we placing a higher value on innovation more than its actual tangible impact on patient care?
I'm gonna grab onto the tail, as we Venezuelans say, with the reference the doctor made regarding insurance companies and their interests. Look, for us, me who had the opportunity, thanks to Dr. Tallaj, to also be the medical director of one of the biggest projects ever done in the area we call innovation, where we managed the data and handled the dollars that were being invested in patient care. In the end, there is such a high percentage of patients that we struggle to reach. When we have those quality meetings with the insurance companies, one of the biggest challenges is the people who are disconnected from the healthcare system. They are insured, which, for example, in Venezuela, we wish everyone were insured, but they are disconnected from the healthcare system despite being in a country with so much technological advancement. So for me, that gap is proof that the human and compassionate side still plays an absolutely vital and essential role because we've innovated, we can accurately identify who they are, we know where they live, and we have their phone number, but we still haven't been able to fully understand the reasons why, what their deep-seated fears are, or exactly how we should approach these patients to help them understand. First, that they trust us, right? There needs to be trust, there needs to be confidence, and second, there needs to be trust in the healthcare system because a lot of times there's trust in the doctor, but not in the healthcare system. And in, like the doctor said, those centers that end up perpetuating chronic conditions instead of resolving them. So, yes, I think there's still a lot of work to do to really understand where each of our patients is coming from, their fears, their past experiences, their educational background. And as I mentioned before, even when they have health coverage, there's still a strong resistance to seeking prevention and being proactive about their medical conditions.
Miguel, can you put the question up again? I don't really remember it very well. Please, it's just my brain. We're measuring well the value of health technology? Or do we still place a higher value on innovation more than its actual tangible impact on patient care?
It's incredibly difficult when you're in our unique situation, specifically from the perspective of how we see things, because we are. They call us disruptors. How do you say that in Spanish? Yes,
Major market disruptors.
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 We believe in a different way of seeing things. It's not that it's disconnected from everything else, but when you see at the forefront of such a difficult moment like the one we lived through during the pandemic, as well as the complete absence of knowledge of most of the people who were in charge of the healthcare sector during that specific period, due to interests that are still being clarified as to what happened, we saw where I want to make it clear that we hadn't earned $140 million working on that project. We used $40 million to provide testing, food, and we managed every single aspect of the operation ourselves. I'm very grateful to the consultants who provided an incredible amount of support, and even the kids. But why am I bringing all of this up right now? Jackie, the following year, it was my turn. The vaccine was available. I was invited to Washington to present the award for the best vaccine. And everyone there was talking about the advances, the technology, everything they did, the millions, like 200 different vaccines around the world. And they were all there. And their whole conversation was about that huge situation. And it was my turn to close. And I said, I feel a little bad speaking in front of y'all. I've heard about all the money you made, all the millions, everything you accomplished, all the future plans. But I'm going to ask you for something. To understand that, I'm here because this morning I was able to give my grandson a kiss. I was able to hug my children. I was able to see people walking happily again. That's what you gave back. With the technology to make a vaccine, you gave life back to the world. And sometimes we forget that. Why do we do this? And I think it was an answer because everyone there lowered their heads. We can't forget that human side. We can't forget. Don't you remember that we couldn't go outside? There were very few of us out there. I think that's the message. That's the most practical message about what humanization is, about advances in technology, how that helps people, and we can't separate ourselves from that.
Well, honestly, there is really not much more that I could possibly add to this conversation. The doctor truly never disappoints us and has just given us the most perfect clothing statement imaginable. So if we were to end our session with that, it would already be incredibly powerful just to hear you speak, Doctor, especially because of the remarkable work you did. You were there for us at the most difficult and challenging moment of our lives.
Yes,
Sent.
already like General Patton.
That is exactly right and totally true. And, well, just as an interesting point of curiosity, a documentary was made about it. And thanks to that, it actually went on to win a prestigious Emmy Award. I mean, besides the gratitude of thousands of families whose lives you saved, can I just ask you?
Say the last word.
Of course. Who did they give it to? Absolutely.
Us, we are human beings, sinners, with all the flaws in the world. Give thanks to the Lord, to God, to Jesus, for allowing us to be in your homes. To you doctors who are watching us, thank you very much.
Well, it's a truly wonderful and heartfelt blessing for every single one of the doctors on your day, and it's absolutely beautiful to see. Honestly, we couldn't have ended it any other way. And from the Thank You Doctor campaign team, speaking as the communications manager for the project, the entire dedicated team, our general coordinator, Alina Herrero, and our very own President Dr. Ramon Tallaj, Chief Executive Officer Mr. Mario Paredes, and the rest of the dedicated team, along with Dr. Jaqueline Delmont, who helps us so much with the campaign. Miguel Sainz, the technical team at Diario Salud, who I give so many headaches to. Well, thank you all so much. In this, well, technology will keep advancing, but what these two essential doctors have made clear to us today, on a day like this, is that prevention is vital, but the patient always comes first. And from the Thank You Doctor campaign, we are providing much-needed visibility and recognition to the vital work of primary care and family doctors in every corner of the globe. So if you want to learn a little more about us, you can take a moment to visit our official website, sign our declaration, and participate in some of the insightful surveys we have available regarding the doctor-patient relationship and artificial intelligence. You can scan a QR code because now you can also become campaign volunteers and take it wherever you think it's needed. So from here, we truly want to thank you. Please allow me to be a bit repetitive, but we really want to express our gratitude because if it weren't for you, we wouldn't be here today doing this for Dr. Ramon Tallaj. Congratulations to both of you and to Dr. Jaqueline Delmont for your work. For the inspiring daily example you set of compassion for those around you. So with that, we bid you a final farewell. Thank you so much, and I hope to see you at the next one.
Bye-bye.
Well, thank you so much. A quick technical note. Remember that those who subscribed will receive an email tomorrow with the link to the recap of this event, a table summarizing what was discussed, a brief selection of the main points, and also a dubbed version into English, which we'll use artificial intelligence to do, so it has its good tools too to help us keep sharing and promoting the campaign. So thank you so much on behalf of everyone. It's an honor to serve as your host, and we'll continue moving forward. So thank you very much, and have a good rest.
You're going to translate it into English, you said?
Yeah.
Out into English?
Dubbed, Doctor.
Dubbed so that other human beings can listen to it, not machines.
Of course, of course. All right then. Thank you so much, everyone, and until next time.